All right. Good morning, everyone, and thanks for joining us. I'd like to call the meeting of the Incarceration Prevention Reduction Task Force, and this is the Behavioral Health Committee. We are meeting virtually this morning, and today is April 16th, 2024. Thanks for all who were able to join us today. My name is Mike Parker. I'm a co-chair. My other co-chair, council member Dan Hamill, is unable to join us today. Talked to him last night. He's got something he has to attend to, and he's bummed because he was pretty excited for this meeting today. So I'll just pass along his apologies, and I'm going to do my best to lead us through.
So Mike, sorry to
Please,
interrupt, Joe here.
no problem.
Just a technical note for everyone who's here. Since we don't have a quorum, the meeting's not officially called to order. This is just an informal discussion. When we do get a quorum, I will let you know, and then it can be called to order at that time.
Sounds good. Thanks for the clarification, Joe. And as always, helping us keep the feet to the fire with open public meetings. Joe, I don't think we have anybody in the conference room. Is that right?
I'm the
you
only
are
one here.
You're there. Okay.
Peter.
Great, Peter, and welcome to you, and happy to see you here. Okay, well, I'll go ahead and read our land acknowledgement. Jill, would you mind scrolling just a little bit for me on that agenda so I can get that a little closer? Thank you so much. Much appreciated. Okay, before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort today to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us all here together today. And please join us in uncovering such truths at any and all public events. As Jill mentioned, we're still waiting on a quorum, so I won't go ahead and call to order. So that was a little premature on my part, so we'll strike that piece. Just going to do a quick agenda review, and I do want to add one piece. So obviously we've got a discussion today. Brian Estes, who's a member of the Behavioral Health Committee, and wears many hats, but is going to lead us through a really an interactive discussion. So obviously we are hoping we get more people, but whoever's here, we're going to really dive into a little bit about how we can make Behavioral Health Committee in focus, more action-oriented. I'll preface a teeny bit about why Dan and I were excited about this topic, why we're excited. Brian's going to talk about it. We in the Behavioral Subcommittee, depending on how long you may have been with us, we do a lot of informational meetings, and those are very useful, and they give members a great deal of information. But when we feel like we have been the most useful and feel the most actualized, is really when we're kind of taking that learning and that knowledge and then using our combined wisdom to make recommendations, which is normally to county council, which may be to prosecutors' offices, wherever that touch point is, where there's behavioral health involved in our carceral system, we want to be more active. So one, we want to make recommendations. So we're, of course, non-binding. We're an advisory body, but we bring a lot of expertise, we bring a lot of pressure, and when we follow up and we go after folks on our recommendations, we think we can get more done. There's been a lot of wins that this committee and the task force as a whole has been behind. We want to keep that. We don't want to say that we haven't been doing those things at all. We have. We want to increase the frequency. We want to increase our own efficacy. And so our co-chairs are pretty excited about that, and we're very excited to have Brian talk to us about that. Really quick, as we're going through the agenda, before we do that, we also have Peter Frazier. If you haven't met Peter already, he is one of our new co-chairs. Peter, thank you for coming today. I knew you were going to do the rounds and come to each of the subcommittee meetings, so we're very happy to have Peter Frazier with us. Bertie Safford is also with us, who is now a new chair, I believe, of the Index Committee. Bertie, if I'm getting that correct. Thank you again for joining us at the Behavioral Subcommittee this morning. Peter, if I'm not mistaken, if it's all right, we might ask you to just speak for a few moments after Brian's piece and talk to us a little bit of kind of about your hopes and dreams and kind of what you're seeing so far with the task force. Would that be all right? Can we call on you after?
May I go first just to kind of set some context?
Oh, yeah, sure. Okay, yeah, you can do that. I'm seeing a nod from Brian, so that's
Okay.
fine. Yeah, no,
That's
please.
great.
And if you're ready now, why don't we go ahead and do that now?
Sure. Yeah, sounds good. Well, I'm so sorry that we have not particularly great attendance today because this is a very important session. And Heather may be joining us. She intended to be here. I just wanted to, first of all, say thank you on behalf of myself and Heather, and that we take our co-chairship very seriously. We have been meeting regularly since we were elected, and we are meeting each time with Dr. Bertie Safford, who is working very closely with us, very action-oriented member of the IPR, and the three of us are getting a great deal done, but kind of behind the scenes. In some of our meetings, we've just made such decisions as we are going to spend the first month going to all the committee meetings as we are here, and listening, asking questions, having an open, honest conversation about how the work of each committee has been going. What are the lessons learned? How can we see more action, more efficiency? And those have been good conversations. I'm delighted that Mike and Dan have asked Brian to lead this discussion. It's typically something we're doing in the other sessions, but that's great. One thing that I want to do, as we've been doing in the other committee meetings, is to turn our attention to our founding document. For this committee, it's actually a pretty old document from 2015, the Incarceration Prevention Reduction Task Force Behavioral Health Programs and Services Ad Hoc Committee Statement of Work. And I would ask that when you have time, just look through it and familiarize yourself or refamiliarize yourself with it. And this is to a point that Mike just made. And in the first paragraph, it asks us on this committee to make specific recommendations to safely and effectively reduce incarceration of individuals struggling with mental illness and chemical dependency, and minimize jail utilization by pretrial defendants who can safely be released. That's the part that seems to be, I know that it has happened in the past, but I would really like to see us to a place where we're making more specific recommendations. The sessions that I've been on this committee for a year or so, and it has been fantastic. I have learned so much, but it seems like, to my perspective, it's been very informational, and I would really like to see a kind of bias towards action, and we can get into this more later, but the work of this committee making those specific recommendations and moving things forward. One thing that two more things I'd like to say about the work that Heather and Birdie and I are doing is that we will be really focusing on the work of our committees and the committee as a whole for the next year. That is planning out a year. And so working with the co-chair, or working with all the co-chairs of the committees, I think that that's going to be very important work for us to put in place a plan for one full year. So really would love for you all to be thinking about what you want to be focused on this year, and Brian's going to lead us through some work to get to that. Another thing that we are proposing, and I see Courtney's on this call, and I feel like she's almost the muse on this one, is I would really like to see focus groups with frontline workers and with people with lived experience throughout the year, where we are taking the ideas, the things that we're working on, any questions we have, and bringing them forward to a focus group of panelists of those two groups. And then raising those issues back up to this level where we're setting policy and making decisions, and get the whole system kind of infiltrated with the voices of people with lived experience and frontline workers. And I think that's going to be a really powerful change to what we're doing, and would like to talk about that more in subsequent meetings. Also, we are, there are some really key documents that we have been reviewing, and of course, the Justice Project Implementation Plan is one of those. And something that went into that implementation plan is the work of the BGAT group. Mike, you were part of that group, and it was very helpful to the Stakeholder Advisory Committee and to the formation of the work product that is the Justice Project Implementation Plan. I would encourage anybody to go back and look at that BGAT work, which was a gap analysis using the SIM, the sequential intercept model, of our local programs and facilities, and looking for those gaps and then rating them. That work was detailed and it was really important. And I think it's something that's going to inform the work that we do in the next year and the year after that. So Heather, I see that you're on the line. Would you like to say anything before Brian takes us through an exercise?
I'm here and mostly listening, so thank you.
All right. Well, thank you, everybody, and feel free to reach out to us. We are at any time. I am always interested in hearing from the people on these committees and the important work that you're doing, looking for gaps, looking for ways we can do things better. So anytime, just reach out to me or to Heather or Bertie. I think that we'll be making great progress over the next few years. So thank you.
Well, Peter, thank you for those remarks and kind of setting us. And it seems like there's a lot of on the same page. So when I hear you're bent towards action, that's exactly where this group is. So we welcome that energy. We're excited about that. I would just comment on the BGAT. That was amazing, and it had a lot of staff time. So one thing that I think we all need to be aware is that most of us are volunteers showing up and aren't getting paid to be here, which is part of the reason why I think we're so valuable. The other thing is realizing that sometimes the task force is going to need paid work. And so Perry Mowry, for example, is really leader of that BGAT group. So working with our county partners, and it's mostly been in health and human services, health and community services, they have been just amazing. And of course, staff like Jill and Jenna are totally amazing too. So the task force has these amazing volunteers and people like myself, but we wouldn't go anywhere without all the work of the county partners that we do and the folks that are paid to help us walk through there. And thank you for mentioning that, BGAT. That was an extremely great process to be a part of. A couple other behavioral health members, I think, occasionally joined that and really helped inform at least that rating piece. But a lot of work went into that, and glad, Peter, that you're finding it useful. And I think it really can be a guidepost. Take that, our PETA continuum, and really it's kind of a way to do a roadmap, but also then to check ourselves as we go, right? How well are we doing in the recommendations we made? Do we ever make that recommendation? Do we follow up? So with that and no further ado, welcome to other folks on the call. Brian, if you're ready, I'm going to go ahead and turn it over to you to lead it through.
Thank you. Thank you, Peter, and thank you, Mike. So as some of you may know, I have a long career with the federal GAO, Government Accountability Office, and then doing similar program evaluation type work with King County Auditor. And both those are what I term legislative oversight. And I think that's partially what the tasking is to this task force is legislative oversight, making recommendations to the council, actually, for change in executive programs. Sometimes we make recommendations to the executive or the, but, so just to step back just a little bit, quite honestly, from my perspective, going forward, I appreciate all of Peter's ideas. I think they make a lot of sense, but quite honestly, I think the council needs to weigh in on statement of work from a number of the task force overall and the committees going forward, quite frankly. That's what this function is. That's not the topic of our discussion today, but from my perspective in the long term, I think it's important that those legislative priorities be expressed by the council, quite frankly. So that's maybe a topic for another time, because some of the things we're talking about doing require a lot of work. And often you need consultants and people with very specialized knowledge, which we have on this collective group. But we lack sometimes, you know, a state or national perspective on some of these issues. So with those kind of caveats, I still think it's worthwhile to have our discussion today about how we can become more action-oriented and what one or two criminal justice programs or policies do we think it might make sense to focus on? And I think the latter is really key, because this committee addresses a number of very wide-ranging issues. And I think if we're going to say step ahead 12 months or 18 months from now, we're going to have to decide what we really want to focus on. Which particular programs or policies do we want to do? And so one meeting in the past that I thought was quite instructive in terms of becoming more action-oriented was the session we had on the Ann Deacon Center. We had first responders there. We had Compass Health kind of explaining the context for some of the concerns they were bringing up. And I think potentially there were some next steps there, and we were going to check in back on that later. So I think that's one example of something where we could be a little bit more action-oriented. So I wanted to just make sure I have everybody here, and we'll go in alphabetical order. So I have Arlene Feld, Peter Frazier, Stephen Glockley, Dan Hamill, Mike Barker, Courtney Taylor, and Heather Flaherty. And there's someone else on the call, Xiao Ying Wu. Are they a community member or member of the public, or?
I'm here as a backup proxy for Heather Flaherty.
Oh, okay. Would you like to speak as well?
I'm happy to, but I don't want to take an extra spot.
No,
That's not appropriate.
No, that's fine. That's fine. I didn't mean to just call you out, but I wasn't sure, you know, what your role was. So with that, why don't we start? And we're asking each committee member to have share their thoughts on how we can become more action oriented and what is one particular criminal justice program or policy that they think might make sense for us to focus on going forward. And I mentioned just one because with the type of work we're envisioning, we really have to focus. So with that, I'll turn it over to Arlene Feld.
Well, I'm very happy to be here and meet you all. Some of you I already know from the past that I served on the IPRTF Legal and Justice Committee for 4 previous years. And on that committee, we had many reports, and one of the important reports was the biggest crimes in the county, which we were told was domestic violence and DUI. Now you have to, it's good that we don't have worse crimes, but it's pretty bad that domestic violence, for example, is on that report. And I would like to see that we have more specialized therapists for domestic violence, because one has to get a specialized training because it's not like therapy in general. And the same, of course, is true of DUIs. But addiction isn't my specialty. I'm working now training counselors who are going to go into practice. I do this part-time. I have over 50 years experience as a therapist. I've worked in most fields for doctor's offices, for private practice, and for a clinic. And I worked for 9 years for the crisis clinic. You spoke about that, and it was named something else before. It was named triage before it was Andegan. And I retired in 2016, but as you can see, I'm not completely retired. I couldn't stand it. And so I have lots of experience, and it's a most interesting goal. And my dream has come true. That is to say, I used to imagine a clinic available for us, and we have it now. We're going to have it now. So I see our role as oversight. Whether there's a formal committee for it or not, it matters a lot to me that we have the right people for that program, and that we, if we have to, we can go outside our district for employment. And I think we should pay a lot too.
Thank you, Arlene. Was there any particular one program or policy?
I think domestic violence, that's the biggest need for incarceration.
Okay,
And DUI, if somebody wants to work on that.
okay. All right, thank you. Peter, oh, I'm sorry, go ahead.
I wanted to say that I was co-chair of the Law and Justice Committee.
Thank you, Arlene.
I'm just gonna be listening to you guys because I'm unfamiliar with this committee.
Okay, and thank you for your sustained service, Arlene, to the community. Okay, Peter Frazier, how can this group become more action-oriented? And you've already mentioned several things I think that would accomplish that. And then what is one criminal justice policy or program you're interested in the Behavioral Health Committee focusing on?
Sure. I'll keep it quick since I've already taken up some time. Just to add on, we had I believe it was a joint meeting where we addressed 988, and that was such a informative meeting. I thought it was a terrific presentation. I would like to just make a suggestion that perhaps next time when we're having a presentation like that, maybe we could do some pre-work and have the presenters put together a one-pager that would give us the basic information about whatever program it is that they're talking about, that everybody could read before the meeting to kind of level set us on the basics. And then that would allow us in our meeting to get into the meat of the matter, if you will, instead of spending a lot of time on introductions and basic info. And then also in regard to that, for that meeting, for instance, we might have asked Allison Everbeck from Watcom and Melora to be ready to respond from a local level how 988 could be integrated, and so that we would be all queued up for what to do next. And then the third element might be to have people ready to consider a motion for action, and what to do about it by the end of the meeting. That's a lot to do in one meeting, but I do think that it might be a template for just going from presentation and now what to presentation really focused and action. So that's one thing to think about. As far as things to focus on, I've already spoken to kind of a more laid out plan and scheduling focus, but one thing I'd like to bring up is the index meeting is very, very important. The index committee, the work of that, and we need to have a clearer idea of what it is the Behavioral Health Committee needs to know, what data they need to have to make decisions on our spend on our programs and the various things we put forward. What is it that we need to know to judge these things and to adjust them? So that's going to be some really serious policy advice that we need from policymakers and folks in this group. So more on that soon.
Thank you, Peter.
Mhm.
Stephen Gockley. Oh, yeah, he's here. Stephen, you're muted.
Thank you, Brian. I'm going to be pretty quick. I'm going to say, and I've talked about these ideas with a couple people on the committee already. I'm going to say that in terms of
Could you speak up a little bit more? We're having your volume's a little low.
let me try to increase the volume here. Is that any better?
Yes.
Okay, sorry about that. I'm going to say in terms of moving us more toward an action orientation, we have discussed a lot of ideas lately. We haven't really compared them to best practices, and we have left them sort of in the discussion stages. In the past, the task force has had success, one example of which is the pretrial processes work group, and another is the competency restoration work group, that have floated ideas and taken efforts to test them out locally on a small scale. The alternative response team actually was also structured that way initially. So I'm going to recommend that we think in terms of initiating our own programs, pilot projects. The council in the past has been open to providing short-term funding to try out ideas. Even a best practice is a best practice in a certain environment under certain circumstances, and may not always work everywhere. So that was one of the things we did with the risk assessment tool in the pretrial processes work group, was we needed to validate that from other jurisdictions to see if it worked as well in Whatcom County. So the idea of structuring pilot projects for promising practices or best practices, and seeking some short-term funding to test those out would give us evidence, would continue a bias toward evidence-based work, which I don't think our discussions have particularly emphasized. So that's what I'm going to say. And in terms of one area to focus on, I'm sort of playing off that pilot project idea, is we face changes in the last couple of years in the issues produced by certain drug infiltrations in the community. Fentanyl being the current one, xylazine being on the cusp. The treatment programs for those are either non-existent or are not super well researched. There is a mode of treatment that I'm just beginning to read about on myself. I've asked Perry, and Perry has provided me a lot of information. Some of it is not current, but there is promise in the treatment regimen called contingency management, which in my layperson's shorthand is paying people to stay clean. Sometimes paying them a significant, what will seem to the public a significant amount of money, $100 a month, $200 a month, whatever. But it shows promise of being effective. And since we have very few alternatives for some of these newer and extraordinarily damaging problems, I would suggest the committee researching that, exploring efficacy in other environments, exploring how do you actually structure a program like that? Who runs it? How much do you incentivize sober behavior? And proposing to the council a pilot project in contingency management.
So, Stephen, just to clarify, so you're suggesting that drug treatment specifically to some of these more recent drugs would be something that this behavioral health committee could develop a pilot program or make recommendations to develop a pilot program. Is that correct?
I am on the assumption that our legwork shows enough promise to make that worth the effort.
Okay. Thanks, Stephen. Dan Hamill.
Good morning, everyone. Sorry, I'm a little bit late here. Just kind of running around. My wife broke her wrist 2 days ago, and we've been dealing with emergency room stuff. And she's better. She's home now. So I'm just kind of running around. I agree with the other speakers had mentioned in terms of ideas that can be generated from this committee. I want to point out just a quick 30-second snapshot. This committee is responsible for the development of the alternate response team, the GRACE program, and to some extent the LEAD program. And I'm looking at other familiar faces here on the screen that have worked in development of those programs. I was at the forefront of all of those items. What I want to bring up here today is something that I think that we need to consider when it comes to more of a 30,000-foot level, and that is the development of the Division Street property into a behavioral health campus. We have the Ann Deacon Center for Hope. We have the work center that's going to be closing down here in a few years, and that building can be converted into multiple different uses. I don't want to get ahead of myself, but I feel very confident that the mobile medical units from the Swinomish tribe, that's looking very positive. We just did a tour with the Whatcom County Health Department, the tribe, and myself maybe a month ago. These are two large units. They're mobile. They look like giant RVs basically, and they will be able to dispense Suboxone and methadone treatment modalities to people who are addicted to fentanyl, which was brought up by Mr. Gockley here just previously. That's looking very positive, and I'm very hopeful that that's going to happen on the west side of that building. And the other component would be the Behavioral Health Crisis Relief Center, the 23-hour relief center that could also be sited there. And then I think that this committee needs to think about recommendations to the county council when it comes to the other half of that building, which houses the work release center. So I think that there's a whole body of work that could be conducted here over the next few years, basically, when it comes to thinking about how can that Division Street property best serve the community, including Bellingham, small cities, and unincorporated Whatcom County, and knowing full well that as we the city continue to develop into the north end of town, that's going to be fairly centrally located. And I think it's just a great opportunity for us to maybe think about what that looks like for the future. And I'll stop there.
Thank you, Dan. In terms of capital projects, that's a very important thing to consider. I'm just wondering, to what extent does the ASO have any kind of a role in helping us maybe sort some of that out?
Yeah, I think that's a good consideration. I think it's a combination of programmatic items and capital facility construction.
Because I know the ASO in the past has had consultants that identify capital project needs throughout the North Sound area. And one of them was a need for an inpatient pediatric facility. I'm not meaning to throw this off track here, but I think you have to look at it at the same time. If we're asking the legislature for funding for some of this, and we probably would, how does what we're doing fit in to the North Sound region?
No, I totally agree. And just for some historical context for this committee, the folks that are on the call today, the task force that we are assigned to is associated with adult individuals and not with minors. And there was kind of a rebel cohort of people that wanted to look upstream, and I'm looking at several faces here happily that decided to do that. And as a result of that, the Prop 5 passed thanks to the hard work of several individuals, and we were able now to address upstream intervention. So I think that we do need to look at that. I just toured the Touchstone facility up in Everson that does youth mental health interventions. So there is a resource here in the community. But Brian, I do agree that we should be thinking broader, and this is the beginning. This is the beginning of conversations. So
no, I'm just saying in terms of a treatment or programs or treatment facilities for 18 plus. North Sound could have a direct or indirect impact on how the legislature, for example, looks at our requests.
Yep.
Okay.
Thank you.
Thank you, Dan. Let's move on to Mike Parker.
All right. Well, I'm really behind the 23-hour center. So that's probably the number one, but that's been said. So I'm going to take a different tack. Like Peter, I spoke a little bit about my excitement about action-oriented, but I'll get a little more specific with a couple of examples of areas in which this committee has been particularly useful. One, we can credit to Ms. Flaherty. So we were stuck in the middle of pandemic and we were getting funds from the federal government and they were not completely purposed yet, right? It was such an evolving situation. And Heather, you might have had buddies, so you're welcome to deflect or to give credit as you wanted to, but really ask the committee to think specifically about what those ARPA funds could be used for. In what way could they maybe help from a behavioral health standpoint, people getting on and out of the jail? Obviously, we had booking restrictions. People couldn't go in the jail, but how could we be creative with that money and use it in a really purposeful sense? So this committee then undertook something that it hadn't to, at least since my time in being here, which was we wrote a letter outlining, we could, through consensus, voted on it. These are the recommendations we'd like to make to the county council. And we
Hey,
said,
Michael, I'm really apologize for interrupting.
no problem.
But Courtney raised her hand and I wonder if she has any time constraints or something. So Courtney, did you want to say something or?
Oh, sorry, I put my hand down because I should have waited. I was just gonna chime in and say, I was ARPA funded. So because of Heather, I am here. And because of my boss. So I just wanted to give that as an example that I was ARPA funded. Thankfully, I'm in the permanent fund now. But because of that work, we got some investigators, we got some more PDs that I think were ARPA funded. I could be forgetting some details, but yeah, just wanted to add that before I totally forget because I'm going to have other stuff to say in a minute.
So, sorry, Michael, I just wanted to acknowledge that.
Oh, that's okay. I can hop right back on my train. It's all right. I don't mind knocking off. So that was just an example. And what I'm going to tease out of that in terms of a process is that we took a formal step. So we do a lot of education and I find that very valuable. I'm a person that likes to ponder and think, and I think deliberate action, well informed, is really important. Rushing into an action before it's rounded out, before perspectives have been received maybe from other jurisdictions, as Brian has brought up, from other entities like North Sound ASO may be important to get the best possible outcome. But once we have done that due diligence, and once our committees have had time to digest that, I think we can make really solid recommendations that are well-founded, well thought out, have good consensus. And then we've got amazing folks who are willing to take that next step and pencil it into a letter that we can send. The other thing that did, by doing a formal step and writing it, it gave us an item to track. So another thing that I think is really important in committee work is just being able to track what you did, what you talked about, what your next step is, and did you complete anything? And when we do formal steps like that, and that's just an example, and I think it was a powerful example, I think it gives us those guideposts, a milestone, if you will. It gives us something to track against. So I found that process particularly useful. And so I think in terms of how we can be more action oriented, Peter brought this up too, but essentially we make whatever statement that we want or whatever ask we want, we direct it, we formalize it and put it into writing, and we send it off. And then we follow up at subsequent meetings. So that's my hope, is to do more of that. I think we've had some good examples, but I would love to see it happen really regular. Whether or not it's every meeting, that may not happen. We may still be educating ourselves on a very toothsome subject and the evidence may be emerging. I'm okay, it doesn't happen every meeting, but I'd like to happen a lot more than it does. So there's my piece on process. Because people have brought up the 23-hour center, and I think that's really critical. So very briefly, I think what we've learned from Ann Deacon Center is it's amazing. It's this great asset. And yet we still had a disconnect over what we thought we were going to get and what we got. And part of that was insurance and other types of operational things that may be they're pretty in the weeds. So I think going into the 23-hour center, which is hopefully going to get some of those items, some of those services, and some of those interventions that we sought, that we didn't get, We want to make really sure that we do that and be really sure that our recommendations are solid, well-informed, and done checking in with the right parties. Briefly, Peter mentioned focus groups, people with lived experience. That has been an ongoing issue ever since I've been in this committee. I would love to see more representation from the communities that are frequently incarcerated, whether that be persons of color, people from incarcerated backgrounds, all of those things, lower income folks. I just look around the room and I see, you know, not as much difference as we could. And that's only one type of identity or intersectionality. There's lots of other experiences that we can't see in a face, but that perspective would be valuable. So now to my issue that I think we should work on. One of the issues that I've seen constantly is when people leave jail, how difficult it is to stay out. And there are so many reasons why that is. So we've been well informed by folks running our jail that Medicaid and Medicaid being shut off and having services not inside the jail has been really difficult. COVID came and cut some of the lifelines and some of the service providers that were able to go into our jail to work with individuals prior to release were cut off. So we've had there's a myriad of reasons why, but the basic state is that folks are getting ready to be released and maybe haven't had a chance, an opportunity, resources in front of them to make good plans, and we can do better. The Healthcare Authority of Washington State, as many of you are aware, has been applying and working with federal government to amend our Medicaid program. One of the things that has just come out is services for folks in jail will be able to turn on their Medicaid before they leave jail. We're going to be able to offer services, case management services, possibly by outside agencies. We'll have to figure out who does this, to folks inside the jail prior to them leaving. They can work on things like transportation and housing. There may be links to some starter money to get somebody started on rent, depending on their eligibility. And Whatcom County, like all the counties in Washington State, is going to need to be able to take advantage of this as quickly as we can. So some of these, if you're aware, it's called the Medicaid Transformation Project. There's information on the HCA website. Some of the needs that I'm talking about are considered health-related social needs. So if anybody studies Medicaid stuff, these are essentially social determinants of health, but there's clear linkage in the eyes of the federal government and clearly the Healthcare Authority that these things are seminal and crucial to them staying out of jail and, more importantly, to their health. So we have an opportunity that's coming. It's brand new. Many of these services are going to be available come in June. Some are immediate. But this is brand new. And this really addresses and hopefully, there is no panacea. It's not going to fix everything with reentry. But I think optimizing our response, working with council to make recommendations, if this is public-private partnership, like so many of these are, who are providers that we can bring? What services do we need to see? How can we both monitor implementation, be supportive of implementation, and really drive the point home if we're not seeing a certain area happening? I'm sad not to see Tank. I know he can't be at every single one, Sheriff Tank, but I'd love to get their take on this particular piece. So I'll stop there, but I think taking advantage of Medicaid transformation and what it can do for those folks who would be Medicaid eligible in our jail is a prescient. It's really time important. And I think it could be really valuable.
Thank you. Thank you, Michael. We're going to go next to Birdie and then Courtney.
Birdie, I think you're muted still.
Now I'm unmuted. Sorry for the delay. Thank you. I'm listening with great interest, and Peter already addressed this a bit, but I would like to put on my chair of the index committee hat and and have all of these discussions framed in what do you need to know in order to start this project, and what type of data do you need to track it? I appreciated Arlene's comment that based on the data of knowing the most common reasons for incarceration, it's domestic violence and DWI when that data was done. And those kinds of informational pieces, I think, can drive our decisions. And so I would encourage all of us to feel free to speak up about what would help inform these issues. And I certainly agree with everything Mike Parker has said. I guess I would put reentry and in its broad scope as my number one issue. It's very multifaceted, and I would really enjoy one of Peter's focus groups on the frontline folks that are working with reentry in the jail now to learn from them their perspective, what barriers are that are not programmatic, as well as barriers that are programmatic. So thank you.
Thank you, Bertie. Is there any timeline for when you would like our committee to provide you with some of our data needs?
That's an excellent question. And I would say within the next 6 weeks, we are making some structural changes on the index committee and are going to have a policy subcommittee that prioritizes data requests. So this is, of course, a very ongoing process. At the same time, if there are basic requests that could be brought out within the next 6 weeks, it would help us get a preliminary start. But it is definitely an ongoing process.
Really quick, I'm going to do a side, Brian, as my co-chair is here. I think we can add in to the next agenda. That would put us into May, and I'm showing that our next behavioral health committee meeting, Bertie, will be the 21st. So we will definitely have a meeting within that time frame, and we'd be happy to devote at least a little bit of time to that agenda to gather the feedback and the wishes of this group and pass it on to you. And thank you for that.
That would be very helpful. Thank you.
Thank you, Bertie. Courtney?
Okay, I'm gonna try to pace myself because I have a lot of thoughts, which I'm sure you all anticipated. And Peter, thank you for what you mentioned earlier about involving frontline staff. It's needed. Otherwise, we're chasing our tails and reinventing the wheel over and over again. There's always going to be a new program name, a new funding source, a new idea, a new model, but we have to focus on the content, why we're doing what we're doing, why we're seeking funding, why the program's changing names. I mean, we get caught in this in the research world with, by the time you've disseminated what you've learned, the problem has grown and changed. And I think for me, what I wish Whatcom County would focus on is kind of like what Dan said earlier, looking upstream. And I mean, fentanyl, domestic violence, and DWIs are not caused by what we think they're caused by. It is a systemic issue linked to poverty and poor access to appropriate evidence-based treatment that is consistent. And what we have happening in Whatcom County is people are being shuttled between multiple siloed services that are ineffective, inadequate, poorly staffed, and poorly funded. So I don't know if I could identify a specific policy, but what I would like to see be different in Whatcom County is have the voices of frontline workers and clients put first, not last. I would like them to be at the mic before anybody else. And I would love to see more support for the training, supervision, and mentorship that's needed in the clinical field right now. Because what we have happening at this brink of the decarceration movement, you have a lot of people that are not prepared to work with our clients because they view them as different. They label them as forensic when they don't even realize that these are the same folks they've been working with for months and years. But the way they are trained and the way our systems are structured, clients are kind of put into this box where you either are or you aren't forensically involved. But the reality is a good chunk of your clients are probably forensically involved. You just might not know it. But what we have happening these agencies that we rely on in town to provide the very services that we're talking about, they are hemorrhaging people. They cannot keep up with their staffing. They cannot keep up with their funding requirements. They cannot keep up with supervision, mentorship, credentialing requirements. And so what you have happen is, I can't tell you how many of my clients who had very high clinical needs, who should have been placed with a seasoned counselor, they got the intern, they got the associate level counselor, they got inappropriate treatment. And that is why people are cycling in and out of jail. We say get treatment, but we don't ask if it's good. We don't ask if it's appropriate. We don't ask if it's evidence-based. Throwing someone incorrect treatment actually creates more damage, and it entrenches the problems that they were already dealing with. And it creates more stigma for themselves that they're receiving from the world, and that internal stigma. They start to lose hope. They start to think, well, if it doesn't work for me, then why do I bother? And so and the other thing I'll say about therapy for domestic violence, a lot of our folks that we've labeled perpetrators, they can benefit from DBT just as much as your survivor of DV. We have categorized our folks to death because of our insurance system, but we have, and the codes that are needed to receive care. And I see all my providers nodding because we're exhausted by this system. And so it's like the things that we're talking about at this committee, all of us in the field, we've been talking about it for 30 plus years. Like, if you want to have your finger on the pulse with what needs to change, get the people doing the work at the mic, make these meetings worth attending, because they don't have time to sit and wait until the end of the meeting to, have their 2 cents included. I think there's a lot of, there's politics within the nonprofit world and hierarchies. Some admins and supervisors are really great at including frontline voices. Some are not. What I can tell you about jail reentry is that they're doing amazing work. What we're talking about, what we want reentry to do, that's what I'm doing right now. That's what my colleagues at the public defenders are doing right now. And that's what the Lifeline reentry team's doing right now. It is already happening, but the problem is there's not enough of us. And the issue, there's so many issues with not enough care in the jail, but also let's look at what happens when someone's released. Do you know how many of my folks can't find housing? Sorry, I'm in a cubicle environment, so the background laughter is really bad timing. But do you know how many of my folks don't have housing, don't have a PCP, teeth rotting out of their mouths because they need to get to the dentist? Like, there's so many things that a person has to be connected to when they get out. And they have us as a bridge, but guess what? The agencies half the time don't have availability to take them, or they don't have a staff member that feels comfortable working with them because what's on their chart just got out of jail. And they see them as different when they may, clinically present with the same picture as someone who did not recently get out of jail. So I could go on, but I see a lot of nodding. I really hope we can get more frontline input. Thank you.
Well, thank you, Courtney.
Hey, Brian, can I jump in real quick here?
Before, Courtney, I just want to clarify, when you say forensically involved, what does that term mean?
Well, so, for my generation, I think it depends on who you ask and how long they've been in the field and what they've done. But when I say forensically involved, they are someone who has interacted with the criminal legal system, and they are known to the service network, whether voluntarily or involuntarily, because that can look so many different ways depending on what the person's navigating. So I would say anybody that has gone to jail, prison, dealing with the restoration system, the way that data is collected matters, because when you're trying to get someone paired with services, it doesn't take long for the assumptions to come out.
So someone who's been touched by the criminal justice system.
Yes. And there's a lot of us. And my point is that you're not going to find what we have happening right now in the mental health field is you have a lot of people. Not only are we losing people, we can't get enough people, but then the people that are staying, some of them are completely resigning themselves and saying, no, I will not work with this population. But most of your clients might have touched the criminal legal system. So if you can't work with folks that have interacted with that system, it's time to find a different job.
Okay, thank you, Courtney. Dan, let me go back to you. I also will note that Perry Mowry has joined us.
Thanks, Brian. So what Courtney's talking about has been a perennial issue with not just this committee, but also with the task force in terms of making sure that frontline workers and folks that are involved in the system have a voice at the table. This has been, since day one, we've talked about this.
I mean, this is a national problem.
Yeah, well, I guess what I'm saying here is that so Mike Parker and I have had offline discussions about, you know, how do we bring in people that are at the very forefront of these issues, and we lost people over the last year. We lost Mike and Chris, who are both involved in the systems that we're talking about here, and my intention, I'll speak for myself, Mike can speak for himself, but my intention is to rebuild this committee so that we have those voices at the table. That's like basic structural integrity in terms of how to move forward. If we don't have those voices at the table, then it's just a bunch of talking heads. And no offense to anybody here, it's not that my intention, but I do want to make sure that we have that representation. I think that that's important. And I just want to make sure that that historical context of that this conversation has happened over and over again, and we recognize it, and we keep failing at that. So I just want to put that out there. And my intention is to rebuild in such a way that we have those voices. Thanks.
Hey, Courtney, you have your hand up.
I'm sorry, I forgot one more thing in terms of the policy thing, not just, supporting our frontline workers with better mentorship, supervision, pay, et cetera. But one thing that I think we could zoom in on is the specific workflows and communication between the hospital, the DCRs, triage, and the police. I would love to see better communication in the field when they're determining what pathways where someone's going to go, because we have a lot of folks that are going to the jail because the DCRs flat out refuse to see them, or the hospital doesn't want them. There's not enough beds. So there's just a lot of issues that I think we could zoom in on. So like kind of the opposite of that 5,000 feet observation that we're taking with some of these issues. I think there's some micro level things that we could talk about that would have a ripple effect, because we heard from all these other meetings that we've had where some officers don't know when to make certain calls or what to do and how to use triage, and then there's a whole other conversation that could be had about the DCRs. So I just want to mention that.
Thank you,
Courtney.
Courtney.
I think I'm going to chime in, Brian, really
Hey,
quickly. This is
Michael, I just wanted to say, I want to make sure we have everybody who's on the call a chance to speak in terms of like just getting initial, comments on these two issues. So could you hold that possibly?
Well, it's going to be really brief, and I'd like to just make it. So to Dan's point about our trying to get folks with different backgrounds in this committee, I would just also remind us all that it's not just an option or something we want to do. It's a charge that we accepted when we joined GARE, right? So as Whatcom County has joined GARE, and one of the central tenets of that is looking at the folks that you have around that table, and maybe you need to move the table to the folks. So that focus group idea could be a way to do that. I just wanted to chime on that one piece. Thank you, Brian, and please proceed.
Now, when Whatcom County, or when we joined what? GARE?
GARE, the Government Alliance on Racial Equity.
Oh, I see. Okay. Thank you for clarifying.
Yeah, no, thank you for having me pronounce the acronym. I appreciate that.
Okay, I noticed Perry Mowry's here, but I also wanted to go to either Heather or Chow Ying. Did you have any comments?
Heather, do you want me to go or do you want to go?
I'd love to just share a couple things. Can you hear me okay? Everybody, this is Dr. Chow Ying Wu. He is an incredible family physician, retired, and an intern at the Chuckanut Health Foundation, and has a depth of knowledge and understanding around behavioral health, and I've asked him to be my proxy, especially because, as many of you know, I'm expecting a new baby here any minute. So thank you, Ying, for being here today. And we checked in with Jill about procedure, and there are going to be some meetings where both of us will be present, but we're going to be very thoughtful about taking up space as to supposing to be one. So, but the one thing I'll add, Brian, I really appreciate this generative, very good discussion. I love the honesty I'm hearing and the directness of what do we need to do next. My brain is like I want to do the zoom out and go back to what were the original goals that we stated for this committee, and what are the 3 steps we want to take and the timeline for each of those steps for those goals. And it's on our incarceration task force website. It's really kind of fun to look back and say, what did we say we were going to do? Did we accomplish it or not? And who is responsible for carrying it forward? And I think that can also help drive agendas and agenda planning, even 18 months out. If you're saying, we said we wanted to evaluate programs. What are the 6 programs we want to evaluate this year? Let's invite the lead team to come and present in June. And I loved what Peter was saying too about that template of, if we just give people that opportunity to fill out the 1 page so we can come in ready to discuss and take some action. And the function of the committee, the value we can bring is that interpretation from, I love everything Courtney was saying, full-heartedly agree, and translating frontline and lived experience into policy recommendations, and really getting to what are the barriers in policy or funding that this committee can help push on and just make progress. So that's my zoom out thoughts on how do we become more action oriented. And all of those programs and ideas that people listed today should be on that work plan list. But let's map that out, that, okay, in 6 months, we're going to talk about, let's invite the Ann Deacon Center team back to report on, hey, are police using this facility more or not, and why? And create those feedback loop opportunities. So Dr. Wu, anything you want to add?
Yeah, I'll be brief. I'm not an expert about incarceration, but I do consider myself to have some experience about how people actually make lasting, profound, permanent change, because that's been my experience. It's the privilege of being a family physician in the same place with the same patients for 30 years, is you get a sense for how people actually make lasting change. And also you get a sense for how change happens for families over multiple generations. So I'll just say a few quick things. This is a big problem. We didn't get here in 12 to 18 months. I think we need to take a 20 to 30 year time frame to think about how we're going to come up with a solution for a problem that our society has created over much longer than that. I think if we think for small solutions that seem attainable, we won't have a solution. I think we need a solution that seems big and unattainable to get a real solution. And I think that's going to take multiple generations, because today's incarcerated person is the adverse childhood experience that creates tomorrow's incarcerated person. So I think a multi-generational approach is crucial. I think that I love what I heard from Courtney. I think we need to have the people with lived experience first and foremost and in decision-making positions, and then the line staff who work with them right behind them, if we want to get real change. Because one person I talked to said, it's hard to recover when you're in a system that is the same system that traumatized you, right? So, and then if we're looking at root causes, I agree with what Courtney said. Fentanyl, DUI, domestic violence are symptoms. They're not causes. And we need to look at what the causes are. And also, I think we need it's a profound problem. We need a profound solution. And so my suggestion in terms of one program to look at is to look at the program that is the most successful reentry program in the world, which is the one that's run in Los Angeles out of Homeboy Industries. If you're not familiar with Father Gregory Boyle, I think that is a person we should learn from. I think a field trip to Los Angeles might well be in order. There are closer locations. They have now established a group called Homeboy Global Network that works within groups all around the world in 33 states. I don't know how many communities. I will send all of you an email with links to, I mean, you can get Father Gregory Boyle in big doses or small doses. There's like TED Talks, Fresh Air episodes, On Being episodes. He has written 3 books. There are 2 books written about Homeboy Industries. I think that's the kind of profound approach that we should look at if we want to have a long-lasting solution. You know, it's not evidence-based like a double-blind placebo-controlled trial, but it is 30 years of experience of continuous operation, and thousands of people successfully re-entered into society, right? And it's just like, you know, when you have somebody who has a heart attack and you're thinking, you know, you want to prevent a heart attack, who's most likely to have a heart attack? Is the person who just had a heart attack. So they practice what's called reverse cherry picking. They take the people who need the help the most and focused on them, because that's where you get the biggest return, right? And so there's just so much in there. And that's my recommendation. I think we should join the Homeboy Global Network and follow that program.
Well, thank you. Those
You need a job. That's what you need when you get out of jail. And if you don't get a job, you won't succeed. It's very simple. It's not complex.
Thank you, Arlene. I just want to, I'm sorry to cut you off, but we only have a few minutes left.
Oh.
I'm sorry. I just wanted to see if Perry Mowry had any thoughts.
Thanks, Brian. I appreciate it, and I appreciate the information that I've been able to hear thus far. And forgive me for my lack of timeliness. Had another meeting that I could not avoid, and so I'm glad I got in the end of this. I like a lot of what I'm hearing. I think that there are models that we can continue to look at. I think that evidence-based practice is an extraordinarily important concept. I think it can be used to a point of where it becomes you know, maybe not a complete value add, but some detractive parts to that. I think that it would be really great to obviously involve, you know, individuals with lived experience for sure, you know, in this group, as well as line staff. It almost strikes me, and maybe, you know, part of it is my role as a supervisor, my role as an administrator, to say, are we going to exclude those individuals, or is there less value in terms of input and knowledge and sort of historical experience for those particular individuals? Because what I do find at times is, although you know, speaking their mind, a line staff person may or may not actually be representing policy and procedure, you know, et cetera, of the program that they are actually working with. So a lot of times they'll identify, you know, I work with so-and-so, and then they'll sort of speak their own, you know, process and so forth, which is valued. But again, are we, you know, what are we after, you know, in that particular piece? So yeah, I think I'll stop there, just in the sense that I haven't been plugged into the conversation up to this point in time, but I'm intrigued, you know, about where are we going. We've got some sort of fresh energy and you know, fresh direction, and so that's exciting to see that particular piece. So thank you for the time.
Thank you, Perry. I know, Courtney, you have your hand up, but before we get to Courtney, I just wanted to say this has been, for me, a very powerful and really profound experience to sort of step back and look at where we might go. I would suggest that going forward, we might want to come up with some kind of operational statement that captures some of the things we've said today that we'd like to do. And before I turn it over to Courtney, I just wanted to check in with Dan and Michael if they had some concluding thoughts. Well, Courtney, do you have something that's very quick?
Yep, it's really quick. I just, on the note about including admin voice, I hope they're included at the table. When we bring more people to the table, like frontline staff, it doesn't mean we have to remove chairs for admin staff. Everybody can be included.
Okay.
That's all I have to say.
And I'm just looking at the participant list, and I think everybody who is a member of the committee or is attending has had a chance to speak. So with that, I'll turn it back over to Dan and Michael. And we have 10 minutes left.
Well, Brian, thank you for leading us through the discussion. I appreciate the homework charge ahead of time to come prepared and to hone thoughts. I think it's evidence today in hearing some of us, and obviously myself, I can go on, but I think it helped me be a little bit more focused and to realize, hey, I'm going to advocate for one thing. As to next steps, well, Brian and Dan, I want you to chime in. Obviously, we want to sit down with you and go over kind of what we've heard. And I think going over the transcripts, and I think one of our purposes, right, in getting that list, and Brian, I don't want to take your thunder, but in what is that one program that you want to see? We have a bountiful list. We go to this committee every year and say, what should we focus on? I like this strategy, though. It's very personal. It's each one of us has advanced really a program that we believe is important enough for the committee to take on and to look at. So I think the next part of the work, and some of it may happen offline in a conversation with Dan and myself, would like to include you as well, is to go over that list, compile that, and then take this back to the committee, because then we're going to need to rank it. So as you heard Peter mention, and Perry, by the way, we talked about your BGAP process, your behavioral health gap analysis group, as kind of a paradigm, right, of effectiveness. And not only did it come up with a laundry list of programs that were important, missing, or needed, it needed improvement, we ranked them. And the ranking and the prioritization, I think, Brian, if I could, is going to be really valuable. We have some great ideas. We've got everybody's advanced kind of their program or what their platform piece is or what we need to do. Now we need to organize that and start actualizing it. And I think also when we do that, and the way in which we go forward from today's meeting is going to be how we model effectiveness, right? So if we're going to accept that change as co-chairs, and I take enormous responsibility, and I know Dan does too, because we have a role in making this functional. We're not the only people, but we have a role, an outsized role, really, in helping chart that forward. So I don't want to keep going. I want to give time for Dan too, but that's what I see is taking that information, listing it out, and then getting prepared to do an exercise of prioritization where we can see, hey, these are your ideas. These are your fellow committee members' ideas. Let's rank them and let's start scheduling it. So Dan, I'll turn it over to you for a few minutes. So glad you could join.
Dan, before we get to you, I just didn't want to lose this thought, and that's looking ahead to our May meeting and the need to have our data requests identified to the index committee. And I just wanted to say to Heather, you have raised a variety of issues about data at various times throughout the last couple of years. And so I just think you could be an invaluable resource to the committee here if you had an opportunity to put some of those thoughts down on paper, or maybe we could have a brief Zoom call before May to codify some of your thoughts in this area.
I like to see that thumbs up. Dan, did you want to take us anywhere as well, or have any comments about kind of next steps and how we move forward?
Yeah. Thanks, Mike. Thanks, Brian. Thanks everyone for the discussion today. I thought it was really generative. In terms of, I liked everything I heard. I think that all these ideas that came forward were good ones. So my question, I guess, is to Jill and Jenna, who are staff members here in on the call. Is it possible for you to kind of collate the ideas that were presented here today so that the co-chairs can take a look and then bring them back to the committee for a ranking process? Jill Nixon or Jenna?
Yeah, we can put together a rough draft list for the committee to refine.
Okay.
Jill, so we actually have a transcript of the meeting, is that correct?
Yes, that's correct.
Okay, yeah, if you could send that to me, I'd appreciate it.
Would you prefer to put together the list yourself, Brian?
Let me look at the transcript first.
Okay.
I do have some experience doing this kind of thing, so maybe I could take a first pass at it.
Okay,
Okay, we'll talk, Jill. Okay, thank you.
he's retired. He's got plenty of time.
Ah!
Just kidding. Hey, I just wanted to provide some context for the group here on the call today. So this group has been one of the most active committees on the task force. I rattled off some of the things that we did early on, all the programs that we came up with, and we're pushing pretty hard on. And then what happened over the course of the last, I don't know, maybe 18 months or so, was that this group became the recipients of presentations, which is fine. That's okay to have that information shared. But what it wasn't doing is it wasn't generating new concepts and new programs. And so that was really the fire that was lit underneath me that prompted the discussions with Mike Parker and others in this committee to try to figure out how can we pivot and go back to being more generative in the things that we do. There's so much need out there. We all know it. I mean, that's undeniable. The things that have been brought up today, the fentanyl crisis, we just had another person that was shot and killed out in the encampment in Cordata. This is an emergency and we need to treat it as such. Dr. Wu, you brought up some good points about looking at things in a different perspective and a profound perspective. And I think that I'd like for us to think about how can we retool our thinking when it comes to what this committee's work can look like. We make recommendations, but we are a strong committee, and we can be that profound committee if we put our minds to it. So I just would like to close with that. I know we've got a couple of attendees here, and we're kind of running out of time. I know we're obligated to provide for a public comment period. I know one of the attendees is actually our policy analyst here at the city of Bellingham, but there might be some other public folks that want to chime in. So I'll go ahead and conclude my comments, but I wanted to thank everyone for the extraordinary conversation today. This is really good. Thank you.
Jill, we never reached a quorum. I never heard you say that. So we didn't have a meeting. We just had a discussion today. But if there are any attendees, we can still open a public comment. Is that correct? Even though we didn't.
Yes, that's correct, Mike. If any of our attendees would like to speak to the group members, because we don't have a quorum today, please virtually raise your hand. And no hands are raised. Thank you.
Well, Brian, I want to thank you for guest hosting. This has been quite functional. I think in the past couple of meetings, we've seen a couple of different hosts. Peter Fraser honored us with a guest hosting. And let me tell you, I think it's functional for you all to hear some different voices, some different perspectives. But I really appreciate the facilitation and the lens that you bring. Brian, I appreciate your time, your thoughtfulness and setting the container. And I look forward to meeting together, going over that list. And next meeting, we can all expect to be bringing our opinions for prioritizing.
Well,
Thank you again.
Thank you.
Yeah.
And there might be a little homework before our May meeting.
All right. Should we look for an email?
Well, I'm just saying in terms of data, we want people to give that a lot of thought, maybe even a survey or something. Sure. Okay. Well, thank you all. I enjoyed doing this, and I agree with Dan and Mike and many others. I think this was a very, very productive discussion.
Thank you, Brian.
Thank you all. Have great days all.
Thank you, everybody.